Your due date is approaching and it's time to pack your hospital bag. Wondering what to pack in your hospital bag? Not sure where to start? Here are some ideas from Maitri. You should have your hospital bag ready to go by 36 or maybe 37 weeks pregnancy, so that there is no last minute rush to fill a suitcase in between the contractions. Hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So today let's talk about the hospital bag. Hospital bags should essentially contain items you might need for yourself, your baby and your partner during the entire length of your hospital stay. It's a good idea to take prior information from the hospital about the items which will be provided by the hospital so that you don't end up buying unnecessary things. The amount of items to be packed also would depend on the expected duration of stay in the hospital. In most of the hospitals in a normal vaginal delivery, the mother is expected to stay for about 2 days of stay in the hospital unless and until you have any complications. Whereas in case of a cesarean section, the stay is usually for about 3 to 4 days. So what to pack in your hospital bag for delivery? So you can roughly divide the items to be packed in 3 categories. Number 1, items needed by the mother. Second, items needed by the baby. And third, items needed by the husband or the partner. So let's talk about the mom first. First, the administrative items, which means that you should carry a copy of your medical records. Keep both the hard copies as well as soft copies handy. Insurance papers with phone numbers of your insurance agent. ID cards, cash and credit cards. Important phone numbers, the hospital's number, the doctor's number, important friends and family's number, a local taxi number just in case you need it. Your birth plan. So what is a birth plan? A birth plan is the record of what you would like to happen during your labor and after the birth. It is an outline of your choices, your preferences during your labor and delivery. For example, your birth plan may include who you want with you during labor and if you would want some medications for the pain. You can basically include anything you think will make your labor and birth more comfortable for you. So we will talk about this in detail in one of the upcoming Maitri videos too. Then coming to the personal items. So you could be carrying your hair ties, clips or headband to keep your hair out of your face as you labor. The hair brushes, the combs, toothbrush, toothpaste, mouthwash, lotions, lip balms, deodorants, nipple cream. Now this is something which will definitely come handy to you. In case you wear glasses, you should carry your glasses, contacts, saline solutions, extra absorbent maternity pads. I'm sure the hospitals also will provide them, but you might want to use the brand you are most comfortable with. Obviously, toiletries, most of the hospitals these days provide the toiletries when you are staying there, but many women like to carry their own shampoo, conditioner, face wash, soap, shower gel, makeup and whatever else it takes to make you feel refreshed after delivery. Aromatherapy and massage oils, many women like to use them, so in case you have decided to use them in your birth plan, you may carry these also. Then coming to the clothing. I know there is no end to it. There is no end to a woman's clothing or the makeup or the toiletries. But just make sure that you carry only whatever is necessary. So most important is extra pairs of underwear suitable for wearing with the large pads. So these are known as maternity wears. Nursing bras or breast pads for any kind of a leaking. Comfortable pajamas and front open gowns. Try and carry front open gowns because that will help in easy checkups by the doctors also. Lightweight, robes or dupattas or shawls to throw on in case you get any visitors there. Cozy socks with grip soles and slippers. You should carry easy slippers also. Front open sweaters and sweatpants in case it's a cold weather. Then the next category is entertainment or food. So snacks to eat during labor. So remember, we as doctors allow only liquids when you are in active labor. So any kind of food which you must be wanting to eat must be approved by your doctor. After delivery also, the hospitals do provide lots of food even in the middle of the night. But in case you want to carry your own crackers, granola bars or fruits, etc., you can do that. But check with the hospitals. Many of the hospitals actually do not allow outside food items. Music or headphones that can plug into your phone. When you are laboring, when you have pain, and there's no better therapy than a music. So make sure that you carry your music and headphones. In case you have long labor, you may want to carry your long thought book, maybe some puzzles, magazines, a deck of cards, laptop or handheld electronic games. I don't know whether you'll be able to utilize them during labor or not, but there's no harm in keeping them with you in case you have a long labor. A baby keepsake book. Now this is something which I really feel is very, very emotional, so that you can pen down some first thoughts and memories when the baby first comes. You can also think of some miscellaneous items like your favorite pillow or maybe a lightweight blanket to snuggle in. All of us have our own favorites. Any mementos you will want with you, such as family photos, your who to call list so that you can share or text the good news as soon as possible. Now let's come to the hospital bag checklist for the baby. So the baby's list could have baby lotion, diaper creams and diapers. Of course, most of the hospitals provide them in plenty, but it's not a bad idea to carry some from your side too. Going home outfits, including socks, mittens, booties, a receiving blanket and a couple of burp clothes. What is a receiving blanket? In which the baby is received. 2 or 3 sets of baby's clothes. Now, in case it's a winter season, make sure to pack sweaters to keep your babies warm, sweaters and pajamas both. Extra layers like a sweater or a bunting plus a knit cap in case it's very cold outside. A soft towel, cap, socks, mittens, all this will come handy. Now coming to the partner. So a fresh change of clothes in case going back home is not possible during the stay for him. Comfortable flats and shoes, as there may be a lot of waiting time. He might need to go to shop in case the mother and the baby needs anything and it is not already available. So make sure that he has comfortable shoes there. Of course, his toiletries, medical information, mobile chargers for all the devices you bring and power banks. Sometimes actually finding a free charging portal may be difficult in a hospital. Sometimes, yes, of course, most of the hospitals do have, charging areas and of course enough sockets in the room, but it's not a bad idea to carry your own power banks too. Is there anything you should not bring with you to the hospital? Yes, you can certainly overdo it when it comes to packing your hospital bag. But here is what not to be brought to the hospital when you are ready to deliver. So number 1 is too much clothing for you or the baby. Just maybe 2 sets each for the mother and the baby are good enough. Valuables. Do not bring expensive jewelry or watches or anything you'll be sad to lose. So it's better to be safe than sorry. And of course, a bunch of cash, carrying that is not a good idea. Lot of diapers too, since the hospital will provide enough for the time you are there. Take some time to pack the bag and double check the items. Once you're satisfied with it, you can place it at an easy to grab place. Now when the time to go to the hospital comes, you can just grab the bag and head out. Also plan how will you get to the hospital, as it could be any time of the day or even in the middle of the night. You can also check with the hospital. You can pre-book the ambulance there also. Most of the hospitals provide these facilities. So peace of mind goes a long way when you are having a baby. Getting things organized beforehand can help you calm any jitters you might have about this exciting, life-changing event. So today, if you found this video useful and handy, give it a thumbs up and do share this with your pregnant friends, and do not forget to like, share and subscribe to Maitri. We will soon be wrapping up our pregnancy series this season. Do let me know what next would you want me to cover next. Till then, take care and stay safe.